Hey everyone, and welcome back. Today we're going to be doing a deep dive into something that you probably don't think about too often, and that's your feet.
Yeah,
But specifically, what happens when they lose sensation?
right.
It's a condition called insensitive foot,
It's
and
insensitive foot.
we've got some excerpts from medical textbooks to help us understand this, and I think it's going to be relevant for anyone who's interested in, things like diabetic foot care,
Yeah.
the effects of spinal cord injuries, or even if you're just curious about how your body handles pressure.
Well, it's fascinating because our feet, they're designed to take a beating.
Yeah, they are.
They're constantly under pressure, right? But they usually manage just fine. But when that system of feeling and responding to pressure breaks down,
Right.
even seemingly small things
Yeah.
can become big problems.
And that's what I think is so interesting about this topic.
Yeah.
We're going to uncover how even slight pressure can be an issue over time.
Okay.
Explore this thing called Charcot joint, which can actually reshape your foot. And then get into some practical tips for daily care.
Yeah, and the key takeaway here is that this knowledge applies to more people than you might think.
For sure, it's not just about extreme cases.
Right.
Okay, so first things first.
Yeah.
Let's define this. What exactly is an insensitive foot?
So an insensitive foot basically means you've lost sensation in your foot,
Okay.
often due to nerve damage.
Okay.
And this can happen because of conditions like diabetes, leprosy, or spinal cord injuries.
So you're saying like you could step on something sharp and not even realize it?
Exactly. That lack of pain signals, that's where the danger is.
Right.
Since you don't feel the pain, your body doesn't react to protect the foot.
Oh, wow.
You might keep putting pressure on the injured area, making things worse without realizing it.
That's unsettling.
Yeah.
It makes you appreciate how important pain signals really are.
They're like your body's alarm system.
Right.
Letting you know when something's wrong,
Okay.
and it's time to back off.
Okay, besides something sharp, what other things can cause damage if you have an insensitive foot?
Well, the research points to three main ways that tissue damage can occur.
Okay.
The first is the most obvious high pressure from a single event, like stepping on a nail.
That makes sense.
Right.
What about the other two?
This is where things get a bit surprising.
Okay.
The second is prolonged low pressure.
Okay.
So imagine sitting for a long time without shifting your position.
Mm-hmm.
That constant unchanging pressure, even though it seems insignificant, can still harm the tissues over time.
Wow. I never would have thought of that.
Yeah,
So it's not just about dramatic injuries then?
exactly. And then the third one is repetitive moderate pressure.
Okay.
Think about the everyday activities like walking.
Right.
The cumulative effect of those repeated movements can also lead to tissue damage, especially if you're not distributing your weight properly or taking breaks.
That's incredible.
Yeah.
These seemingly small things can really add up. It makes you realize how crucial it is to be aware of these risks, especially if you have a condition that affects your foot sensation.
Absolutely. And one of the most common conditions that can lead to an insensitive foot is diabetes.
Right. I know diabetes has a lot of complications.
Yeah.
But what's the connection here specifically?
So over time, high blood sugar levels can actually damage the nerves in your feet.
Wow.
This is known as neuropathy.
Okay.
As a result, your reflexes might be slower, your nerves don't conduct signals as effectively, and you can even lose proprioception.
Proprioception.
Yeah.
Okay, you're going to have to break that one down for me.
Think of it this way.
All right.
Close your eyes and reach out your hand,
Mm-hmm.
even without seeing it, where your hand is in space, right?
Yeah.
That's proprioception at work.
Okay.
It's your body's awareness of its position and movement.
So if you lose proprioception in your foot, you might not be able to tell how it's positioned or how much pressure you're putting on it.
Exactly. You lose that automatic adjustment and awareness, making you much more prone to injuries and ulcers.
And those ulcers can become pretty serious, can't they?
Absolutely. The sources we're looking at actually outline a grading system for foot lesions
Okay.
from grade 0 to grade 5.
Yeah.
Based on how deep they are and whether there's infection or gangrene present.
So grade 0 means no open wounds, and grade 5 is the worst case scenario.
You got it.
Okay.
And what's concerning is how things can progress.
Yeah.
A seemingly harmless callus can turn into an ulcer, which can then lead to an abscess and potentially gangrene.
Wow.
In some severe cases, surgical removal of the tissue or even amputation might be necessary.
That sounds intense.
Yeah.
When you say surgical removal, what exactly does that involve?
It's called surgical ablation.
Okay.
It essentially means they remove the damaged tissue to prevent the spread of infection.
Okay.
And unfortunately, in
Yeah.
the most severe cases, that could mean amputating a toe, foot, or even part of the leg.
Right.
But the goal is always to preserve as much function as possible while ensuring the patient's overall health.
So we've covered how damage can happen and how serious it can get.
Right.
But what about this Charcot joint you mentioned earlier?
Yeah.
That sounds kind of mysterious.
It's a fascinating condition and a bit of a medical mystery, to be honest.
Okay.
Basically, a Charcot joint is the destruction of a joint due to neuropathy. It often occurs in people with diabetes, and it can drastically alter the foot's shape and function.
Wow.
Imagine your foot suddenly changing shape.
Yeah.
It can be quite debilitating.
That's a big deal. What causes it?
There are two main theories.
Right.
The first is the mechanical theory, which suggests that the lack of pain response leads to excessive stress on the joints.
So the joint is basically being overloaded because it's not getting the usual signals to ease up.
Precisely.
Wow.
The second theory is the neurovascular theory.
Okay.
It points to abnormal blood flow to the joint as a contributing factor.
So either too much stress or not enough nourishment.
Yeah, that poor joint can't catch a break.
Right.
It's a complex interplay of factors, and the exact mechanisms are still being studied.
Okay.
But what we do know is that early detection and management are critical to preventing further damage.
So let's move on to what people can do to protect their feet, especially if they're at risk for these complications.
Yeah, that's a perfect segue.
What kind of daily care routines are we talking about?
The materials we have actually provide some very practical daily care instructions.
Okay.
For starters, it's crucial to inspect your feet every day for any signs of inflammation or breaks in the skin.
So just taking a few minutes to really look them over.
Exactly, and then washing them gently with mild soap and water.
Okay.
Making sure to dry them thoroughly, especially between the toes.
Right.
It's also important to apply oil or lotion to prevent cracking.
I know dry skin can be a problem, especially on the feet. What else should people be aware of?
Avoiding external heat sources is important.
Okay.
Things like hot water bottles or heating pads can cause burns without you realizing it. And always check your shoes for any debris before putting them on.
That seems simple enough, but I bet a lot of people don't think about those things.
You'd be surprised, and of course wearing properly fitting shoes is crucial.
Right.
That might seem obvious, but the type of shoe can make a huge difference.
Speaking of shoes, are there specific types that are better for people with insensitive feet?
Absolutely.
Like, should you be avoiding high heels or anything like that?
The sources highlight the importance of orthotics and proper footwear.
Okay.
Soft insoles, like those made from plastizote, can distribute weight evenly and provide much-needed pressure relief.
Plastizote, got it. So beyond the insoles, what about the shoes themselves?
Low-heeled shoes with spacious toe boxes are key.
Okay.
Especially if there are any deformities, you want to make sure there's enough room to avoid rubbing or pressure points.
So even those seemingly small features in a shoe can make a real difference. Are there any other modifications that can help?
Yes. Things like metatarsal bars, which are placed behind the ball of your foot, or rocker soles, which have a thicker, rounded sole to reduce strain on your toes, can further distribute pressure and reduce strain on specific areas.
Got it.
Some individuals might even need ankle foot orthoses or AFOs for additional support and stability.
It sounds like there's a whole world of specialized footwear out there.
There is.
What happens if these modifications aren't enough?
In some cases, surgery might be recommended to correct deformities that make it difficult to wear shoes comfortably.
Oh, wow.
This can range from procedures to remove bone spurs to more complex reconstructions.
And in the most severe cases, I imagine amputation might be considered.
That's right. It's always a last resort, but sometimes it's necessary to prevent the spread of infection and maintain overall functionality.
Right.
It's a difficult decision, but in some situations, it can actually improve the patient's quality of life.
This has been incredibly eye-opening. So far, we've learned about the causes of insensitive foot, the different ways damage can occur, and the importance of daily care and proper footwear.
And we've only just scratched the surface.
I was going to say.
There's still so much more to explore, like the psychological and emotional impact of living with this condition.
Right.
And the latest research on the horizon.
Yeah.
For instance, scientists are working on things like nerve regeneration and even smart shoes that can alert you to potential problems.
Full-on smart shoes.
Smart shoes.
Like shoes that can think.
I know, right?
Okay, now I really need to hear more about this.
It sounds futuristic, but it's a great example of how research is trying to address this condition in new and innovative ways.
Well, I am definitely hooked, but for now, let's pause here, and when we come back, we'll continue our deep dive into the insensitive foot, going a little bit deeper into its impact on daily life and exploring those exciting new advancements. All right, see you in a bit. Welcome back. Before the break, we were talking about how the right footwear can be really life-changing for someone with an insensitive foot.
It really can, we take for granted the simple act of walking comfortably.
Sure.
But for someone with this condition, the wrong shoes can mean constant pain, blisters, and even serious complications.
You mentioned some pretty incredible advancements in footwear, like smart shoes that can detect problems.
Right.
But before we get into that, I'm curious about just the everyday challenges people with insensitive feet face.
Okay.
What are some things that our listeners might not even realize?
One of the biggest hurdles, I think, is simply a lack of awareness.
Okay.
A lot of people don't even know that they have an insensitive foot until it's too late.
Right.
They might dismiss a minor cut or a blister, not realizing how dangerous it can be without that early warning system of pain.
It's like you said earlier, pain is our body's way of telling us something is wrong.
Exactly. Without it, we're missing crucial information.
And even when people are aware of their condition, it sounds like managing it can be a constant struggle.
It is.
Something as basic as putting on socks or walking barefoot could become difficult or even dangerous.
Yeah. I mean, things we take for granted.
Yeah. And I imagine it impacts things like exercise and recreation too.
Absolutely. Finding activities that are safe and enjoyable could be a real challenge. High-impact sports or anything that puts a lot of stress on the feet might be off the table.
Right. So it becomes a process of adapting and finding new ways to stay active and engaged.
Precisely.
And that can have a real impact on mental and emotional well-being too, right?
It does.
I mean, there's got to be a sense of frustration, maybe even anxiety and even isolation that comes with living with an insensitive foot.
Exactly. Imagine having to constantly think about every step you take, worrying about injuring yourself without even realizing it.
Right.
It can take a toll on your confidence and your ability to just participate in everyday activities.
So what can be done to support people who are facing these challenges?
Well,
besides the footwear and daily care routines we talked about, are there other options out there?
Yeah, well, first and foremost, raising awareness is crucial.
Yeah.
The more people know about insensitive foot and its potential consequences, the better equipped they'll be to protect themselves and seek help when needed.
Education is key as always.
Right.
What about specific treatments? Are there things that can help people manage their condition and improve their quality of life?
Absolutely. Early detection and intervention are critical. Regular foot exams by a qualified healthcare professional are essential.
Yeah.
Especially for those with diabetes or other risk factors.
So if you're in a high-risk group, regular checkups are non-negotiable.
Exactly. And beyond that, there are a number of therapies that can be helpful.
Okay.
Depending on the individual's needs, things like pain management techniques, specialized wound care, and even custom-made footwear designed to accommodate deformities or pressure points.
It sounds like a multifaceted approach is needed.
It is.
Involving a whole team of healthcare professionals.
You hit the nail on the head.
Really interesting.
It's not a one-size-fits-all solution. Each person's condition is unique, and their treatment plan needs to be tailored to their specific needs and goals.
This has been really insightful. It's clear that insensitive foot is a complex condition.
It is.
With kind of a ripple effect that goes far beyond the physical symptoms.
It does. But what's also clear is that there's hope.
That's good.
With increased awareness, early intervention, and ongoing research, people can live full and active lives despite the challenges they face.
Speaking of research, you teased us earlier with the concept of smart footwear.
Yeah.
Can you elaborate on that? It sounds straight out of a science fiction movie.
It does, doesn't it? But this is a real area of development. Researchers are working on shoes with built-in sensors that can monitor pressure points and alert the wearer to potential problems before they even feel them.
So these shoes could actually prevent injuries from happening in the first place.
That's the goal. It's a game changer for people who might not be able to feel a developing blister or a cut. Imagine getting a notification on your phone that says, hey, you're putting too much pressure on your left heel time to adjust your weight.
That would be amazing.
Right.
It would give people a level of control and awareness that they wouldn't otherwise have. Are there other promising areas of research that you're excited about?
Absolutely. One of the most fascinating areas is nerve regeneration.
Oh.
Scientists are exploring ways to repair damaged nerves in the feet.
Wow.
Which could potentially restore sensation and prevent many of the complications associated with insensitive foot.
So we're potentially talking about reversing nerve damage, not just managing the symptoms.
Exactly. It's still in the early stages, but the possibilities are incredibly exciting, and it's not just about high-tech solutions.
Right.
Researchers are also looking at simple, low-cost interventions that can make a big difference.
Okay.
For example, studies have shown that something as basic as daily foot massage can improve blood flow and sensation.
It's amazing how something so simple can have such a profound impact.
Yeah.
It really reinforces the importance of taking a holistic approach to foot health.
It does.
But all this research is just one piece of the puzzle, right?
Right.
What about access to care and resources?
That's a critical point. All the research and technology in the world won't matter if people can't access it.
Right.
There's a real need for greater awareness and education among healthcare providers, especially in underserved communities.
Yeah.
We need to ensure that everyone, regardless of their background or socioeconomic status, has access to the knowledge and resources they need to protect their foot health.
That's such an important message. It's not just about developing solutions. It's about making sure those solutions reach the people who need them most.
Exactly.
This deep dive has been incredibly insightful. It's clear that insensitive foot is a condition that can affect anyone.
It can.
It's not just about diabetes or spinal cord injuries.
Yeah.
Nerve damage can occur from a variety of causes.
It can.
Including certain medications, infections, and even exposure to toxins.
Right.
So it's crucial to be aware of the risk factors and to take steps to protect your feet, even if you think you're not at risk.
Absolutely. And if you do have any concerns, don't hesitate to talk to your doctor.
Good advice.
Early detection and intervention can make a world of difference.
This has been a truly fascinating and eye-opening exploration into the often overlooked world of the insensitive foot.
It has.
But before we wrap things up, I want to shift gears slightly and talk about something you mentioned earlier, the psychological impact of living with this condition.
Okay.
We talked about the practical challenges,
Right.
but what about the emotional and mental toll it can take?
That's an incredibly important aspect that often gets overlooked. Imagine the frustration of not being able to feel your feet properly, the constant worry of injury, and the limitations it can place on your daily life.
It's a lot to deal with.
It is.
It sounds like it can really impact a person's sense of self and their ability to enjoy the things they used to.
Absolutely. And because it's an invisible condition, it can be difficult for others to understand what someone is going through.
Right.
This can lead to feelings of isolation and a sense that no one truly gets it.
So how can we better support people emotionally and help them cope with these challenges?
First and foremost, it's about creating a space for open and honest conversation. Encourage people to talk about their experiences, their fears, and their frustrations.
Yeah.
Let them know that they're not alone and that their feelings are valid.
It's so important to validate those feelings and make people feel heard.
Absolutely. And beyond just listening, it's about offering practical support.
Okay.
Help them find resources, connect them with support groups, and encourage them to seek professional help if needed.
So it's about creating a network of support that addresses both the physical and the emotional aspects of the condition.
Exactly. It's about treating the whole person, not just the symptoms.
Right.
And it's about fostering a sense of hope and empowerment, even though there are challenges.
Yeah.
There are also ways to manage the condition, adapt to its limitations, and find joy in life.
That's such an important message. It's not about letting the condition define you. It's about finding ways to thrive despite it.
Exactly.
Well said.
Thank you. And on that note, I think it's a good time to take a quick break. When we come back, we'll wrap up our deep dive with some final thoughts and key takeaways for our listeners. Stay with us.
And we are back for the final part of our deep dive today on the insensitive foot.
Insensitive foot.
And, we've been exploring all these different facets of it, a condition that affects way more people than you might think.
It does. It's been a fascinating journey.
It has.
From the, intricate mechanics of tissue damage to the emotional and social impact.
Right.
There's so much to learn.
We've covered a lot of ground, but as always, I want to make sure our listeners walk away with practical knowledge that they can apply to their own lives. So let's shift gears here a little bit to actionable steps.
Okay.
What are some things that people can do every single day
to
protect their feet and minimize the risk of these complications?
Well, that's where those daily care instructions that we talked about earlier become absolutely crucial.
Okay.
It starts with being vigilant and making foot inspection a non-negotiable part of your routine.
So we should be looking at our feet every day, like really paying attention.
Every single day.
To what's going on down there.
Exactly. Take a few minutes each day to carefully examine your feet. Look for any signs of redness, swelling, cuts, blisters, changes in skin color, anything out of the ordinary.
So it's about catching those small issues before they become big problems.
Early detection is key.
What else can people do?
Washing your feet gently with mild soap and water is essential, and don't forget to dry them thoroughly, especially between the toes.
Yeah.
Moisture trapped in those areas can create a breeding ground for bacteria and fungal infections.
All those little details.
The little things.
What about moisturizing? I know dry skin can be a problem, especially on the feet.
Moisturizing is definitely important to prevent cracking and keep the skin supple, but be mindful of applying lotion between the toes, as that can actually increase the risk of moisture buildup and infection.
Oh, okay.
Stick to the tops and bottoms of your...
Good to know. Now let's talk a little bit more about footwear.
Sorry.
We touched on this,
right?
The importance of wearing proper shoes, but can you give us some specific guidelines?
Sure.
What should people be looking for when they're shopping for shoes, especially if they have insensitive feet or are at risk for developing this condition?
When it comes to footwear, comfort and support should be your top priorities.
Okay.
Look for shoes with a wide toe box.
Okay.
That gives your toes plenty of room to move around and prevents cramping or pressure points.
So avoid those pointy-toed shoes that are so fashionable these days.
Definitely, fashion should never come at the expense of your foot health.
Makes sense. What about the heels?
Opt for shoes with low heels.
Okay.
As high heels can shift your weight forward and put excessive strain on the ball of your foot and your toes.
Makes sense. What about materials? Are certain types of materials better than others?
Breathable materials are essential.
Okay.
To allow your feet to breathe and prevent excessive sweating, leather is a good option, as it's both durable and breathable.
What about athletic shoes? Any tips for people who are active or enjoy sports?
Absolutely. If you're active, it's crucial to choose athletic shoes that provide adequate cushioning and support for your specific activity.
Okay.
And make sure to replace your athletic shoes regularly, as the cushioning can wear down over time.
Don't wait till they're falling apart.
Right.
An investment in your foot health.
It is.
Now, beyond footwear, are there any other lifestyle changes that can help people manage insensitive foot or prevent it from developing in the first place?
Absolutely. Maintaining a healthy weight is crucial.
Okay.
Excess weight puts additional stress on your feet. Regular exercise can also improve circulation and overall foot health.
So it's about finding that sweet spot between protecting your feet and staying active.
Exactly. And another crucial lifestyle factor is smoking cessation.
It seems like every deep dive we do comes back to smoking.
It does.
It really is bad for your health.
It constricts blood vessels, which can impair circulation and make it harder for wounds to heal.
It has a domino effect on our health, and foot health is no exception.
No, it's not.
Well, this has been an incredibly insightful journey into the world of the insensitive foot.
It has.
We've learned so much about its causes, the challenges it presents, the latest research, and most importantly, what we can do to take charge of our own foot health.
Exactly. And I hope that this knowledge will empower everyone to be proactive about their foot health and seek help when needed.
This has been a truly fascinating and empowering deep dive.
It has.
And I want to leave our listeners with a final thought. To ponder, we've talked a lot about individual responsibility when it comes to foot care.
Right.
But we don't exist in isolation, right?
We don't.
We're part of a larger community, and we have a collective responsibility to make sure that everyone has the knowledge, the resources, and the support they need to live healthy, fulfilling lives.
I agree.
So think about how you can contribute to that vision. It could be something as simple as sharing this information with a friend or family member, or advocating for better access to care in your community.
Yeah.
Even small actions can make a ripple effect and create positive change. So until next time, take care of yourselves, and don't forget to show those feet some love.